This presentation is on plasma proteins, in particular phase proteins, which are of two types, positive and negative. Positive acute phase protein include alpha-1 antitrypsin, alpha-2 macroglobulin, beta-2 microglobulin, C reactive protein, and ceruloplasmin. So remember mnemonic to remember positive acute phase protein is A square B C square. Transferrin retinol binding protein, albumin and prealbumin are negative acute phase protein, and the mnemonic to remember. Coming to alpha-1 antitrypsin, it's alpha-1 globulin and its main function is to inhibit all serine proteases. These are the enzymes which have got serine at its active center, and these include plasmin, thrombin, trypsin, elastase and cathepsin. Emphysema is a clinical significance associated with decreased synthesis of alpha-1 antitrypsin. Normally, alpha-1 antitrypsin inhibits elastase so that the elastin protein, which is responsible for recoil of the lung, is not affected. In deficiency of alpha-1 antitrypsin, what happens is elastase is not inhibited and it will degrade elastin of lung, resulting in loss of elastic recoil of the lung and enlargement of the airways. It is characterized by without fibrosis. Next is alpha-2 macroglobulin. It is a alpha-2 globulin, and main function of alpha-2 macroglobulin is inactivation of all proteases which are associated with degradation of proteins to peptides. Apart from this, it also acts as mild anticoagulant and it's a carrier of growth factor. Alpha-2 macroglobulin is increased in nephrotic syndrome where there is damage to glomerular permeability resulting in loss of all low molecular weight proteins. As a compensatory mechanism, alpha-2 macroglobulin is increased, and the other reason is it being a high molecular weight compound, it is not excreted in nephrotic syndrome. Next is beta-2 microglobulin. This is responsible for forming light chain of class 1 major histocompatibility complex. Now this beta-2 microglobulin is freely filtered by the renal glomerulus and is excreted by the kidneys, and this excretion is increased in multiple myeloma characterized by abnormal proliferation of plasma cells, in chronic lymphatic leukemia, abnormal proliferation of leukocytes, renal failure where there is damage to the kidneys and kidneys fail to excrete the toxic substances and waste product, resulting in increased in beta-2 microglobulin, and also proximal tubular damage as in Fanconi syndrome. So in all this condition, beta-2 microglobulin is increased in serum or blood apart from being it a positive acute phase protein. Next is C reactive protein. It is so named because it reacts with C polysaccharide of capsule of bacteria pneumococci. Main function of CRP is to activate complement and phagocytosis by macrophages. So HSCRP, also known as high sensitive C reactive protein, it's a predictor of coronary artery disease. The last one is ceruloplasmin. It is alpha-2 globulin and it has got 6 to 8 copper atoms in its structure. The main function of ceruloplasmin is it acts as a peroxidase which oxidizes ferrous to ferric form so that this gets incorporated into transferrin and is transported to the target tissues. Apart from this, ceruloplasmin also acts as antioxidant. Now this ceruloplasmin is decreased Wilson's disease. Now coming to in detail about ceruloplasmin, because this will be asked as a 5-marker question or a 3-marker question in the university exams. So ceruloplasmin, as we now know, it is alpha-2 globulin and contains 6 to 8 copper atoms. So the main function of ceruloplasmin is to oxidize ferrous ion so that it gets converted to ferric. Now this is bound to transferrin and it is transported to its target tissues. So the next function is it acts as antioxidants by preventing Fenton reaction. What is this Fenton reaction is? Now this ferrous ion, when it is present, is dangerous because this will react with hydrogen peroxide and ferrous gets oxidized to ferric form and hydrogen peroxide gets converted to hydroxyl ion and hydroxyl radical. Now this can elicit a series of damage. These can cause series of damage to all the biomolecules like carbohydrate, proteins and lipids. Now by chelating this ion, ceruloplasmin acts as antioxidant. The normal level of ceruloplasmin is 20 to 50 milligram per deciliter. Now, apart from this ceruloplasmin being a positive acute phase protein, so the other clinical significance is Wilson's disease. Now, this Wilson's disease is characterized by defect in or mutation in ATP7B, which is a transporter, and because of this mutation or a defect here, copper is not excreted from the cells and copper gets accumulated. When this accumulated copper in turn inhibits copper incorporation into ceruloplasmin. So as a feedback mechanism, the ceruloplasmin decreases. The levels falls below 20 milligram per deciliter in Wilson's disease. Now here the copper is getting accumulated in liver, resulting in cirrhosis. It is accumulating in the basal ganglia, contributing to the development of lenticular degeneration. It is getting accumulated in the cornea of the eye as Kehr-Fischer ring, and when it gets accumulated in the kidney, it will lead to the development of renal failure, and in bone marrow it results in the development of hemolytic anemia. So this was about ceruloplasmin and Wilson's disease. So next video will be on negative acute phase proteins.